Like in my case, when I was doing my MSE, I expanded to the point where I developed a kind of a pain, a sharp pain up here. And I'm thinking actually, after looking at this diagram that you presented, that maybe my maxilla was bumping into my buccinator and was causing some pain or something like that. But
Sure.
but I guess what I'm saying is,
So
do
it
you
is
need?
Ron, the area that you're pointing out, when you overexpand the maxilla, you're going to run into chronoid process of the mandible. Do you remember the shape of the mandible? The chronoid process, you know what it is? That is holding the end of the temporalis muscle. So somewhere here, we have the chronoid process of the mandible. If you expand the maxilla too much, you're going to run into the chronoid process of the mandible, and that's painful.
But if you expand the mandible, can you push that out?
That's right.
Because the
When you expand the mandible, the chronoid process also is going to be not as much as the symphysial area, but yes, chronoid process is going to be about 3 or 4 millimeter expanded, not much more than that.
can you point to where that is in the
The
on you?
chronoid process.
Yeah, on your face so that we can see.
Yeah, chronoid process. Okay, let me bring you a skull so I can show you.
Okay,
Hold on.
sure.
Actually, Ron, you are asking the question that during these last 10, 15 years we have been asking and failing and asking and failing. So that comes, recently, starting 10 years ago, our failures are much, much less. So the chronoid process is this. I'm
Mm,
pointing to this. Do you see this?
mm.
So if the maxilla, if I do it right, if it's overexpanded, see how in the here
Yes.
it is colliding. So, but if we expand the mandible and get the chronoid process a little bit out, not too much,
Back the model up a
because
little bit, doctor. Back it up a little bit. It's out of the frame. Yeah, that's better.
okay. So when you do this, you expand the maxilla, all right? The first thing that if it's overexpanded is going to again hitting this.
Yes.
All right, that's what you feel and is bother if we expand the maxilla too much.
That's
You see this?
exactly
I
where my
exaggerate.
pain was.
Yeah, right there. Now, the expansion of the mandible, the condyle is not going to move the way that we do it, but the chronoid process minimally, maybe 2 or 3 millimeter is going to be wider, except the front is going to be about 10 millimeter wider.
Hmm. Hmm.
Did I answer your question?
Yes, that answers my question. So
Sure.
again, this is just another example of how mandibular expansion increases the opportunity to expand the maxilla.
More, yes, more efficiently. Yes.
Yeah.